was a call I have to attend. Sorry for interruption. Now, Dr. Gracilis introduced the use of mercurius when it is the sulfur is not working. Okay. Now, before going further to the 6th edition, we are reading only 5th edition and Posology. Now, open Posology chapter of Stuart Close. Posology chapter of Stuart Close. That we have discussed choosing the potency. Posology consists of 2-3 things. Okay. Posology consists of, what is posology? There's definition of posology you need to remember for your exam, university exam. Okay. The science of doses and what are particular definition the examiner needs, you need to study for your university exam. Just read that. But where we are more concerned with this practical part of the posology. So posology consists of few things. Number 1, potency. Okay. Number 2, repetition. How you will repeat potency, which potency you want to give, and number 2 is how you will repeat. Subsidiary to this repetition, repetition, there is a thing called remedy effect. You have to study this. This is an extra topic for posology. Whole of your posology repetition depends upon the effect of remedy or remedy reaction. Okay. I hope I'm clear. 2 things was there, potency and repetition. Subsidiary to this repetition, there is called effect of remedy. Effect of remedy. Okay, and you need to study this because this is not coming under posology. This is not coming under posology, but you need to learn this effect of remedy because you need to repeat your medicine. Okay, you need to repeat your medicine. What Hahnemann have said in aphorism number 245, remember it again, that every striking amelioration, progressive amelioration precludes all the repetition, Okay, we have repeated in this class from a lecture, a bit of portion of the lecture from the previous class. Those for those who have not followed the previous class may go and follow the previous class also, and for those who are attending today only to make them aware of this, that what we are dealing with, we have repeated a portion of the last class. Okay, so in 245, every perceptible, progressive and strikingly increasing amelioration in a transient. Who will decide there is a progressive striking amelioration is there or not? This effect of remedy, by this effect of remedy you will able to judge. Okay, you will be able to judge by this effect of remedy. Clear? So this effect of remedy is being judged by. We have tools to judge this effect of remedy, that is Kent's 12 observation. Okay, or Hahnemann's signs of improvement. Okay, Hahnemann's signs of improvement. Go to content, and you will see 252 to 256 signs of commencing improvement. What is this? This is also the effect of remedy. Signs of commencing improvement. This both include aggravation and amelioration. Remedy reaction of Roberts. 2 most common reaction the remedy will have on a body is either it will ameliorate the case or it will aggravate the case. These are the 2 most common action of the remedy, 2 most common reaction of the remedy or effect of remedy of Stuart Close, which we have discussed. Okay, and according to this repetition can be used means can be, this repetition can be judged through the second prescription, can be guided through the Kent's second prescription. Okay, there is a prescription in Kent's second prescription chapter, that is repetition of the medicine, repetition of the medicine. Okay, clear? Now go to Posology of Stuart Close and we'll start. We have read in the last class that this potency will depend, I think it's page number 192. Page number 192. This is a potency, the consideration influence in the chronic choice of doses. Choice of actually the potency, the susceptibility of patient, seat of disease, intensity of disease, nature and intensity of disease, stage and duration of disease, and previous treatment of disease. This previous treatment of disease is also important. How you will discuss. There's 5 points Stuart Close have given, and 1 point we have added from Hahnemann's this footnote, that is the nature of the remedy we are using. Whether you are using nosode, whether you are using an inert substance, according to that the potency will be differing. If you are using lycopodium silicea, you need to give it in above 30 potency, because it won't work in the, because these are the inert substance and you have to raise the power of those inert substance to the dynamic level so that they can act. The susceptibility of patient, seat of disease, susceptibility of patient is one of the, so 5 plus 1 from Hahnemann, 5 plus 1 is from Hahnemann, that is the remedy. 1 for patient, 4 for disease, and 1 for remedy. This susceptibility depends upon different things. Susceptibility of the patient depends upon different things. You will read it by yourself. Any confusion you will ask me. Okay, that susceptibility depends upon. Now I want you to underline something. I am not getting my old book, so I have to search it here and I will tell you. This susceptibility of the patient. I think it's where the susceptibility is modified by pathological condition. Susceptibility is modified by pathological condition. Okay, this we have discussed many times before, that how a patient, what Close is referring a patient of digitalis, it was not actually giving any effect in high of the highest and lower of the lowest, that is Q potency, and allopath cure it with the crude dose. That is, the susceptibility was that low that even the mother tincture was not resonating with the pathology, so it has to be given in the crude dose. Okay, so there is a notion made and popularized, that was popularized by Kent. There is a notion which was popularized by Kent. When there is a pathological case, you need to give your remedy in low potency, and that is not 100% true. Okay, that is not 100% true. Now why it is not true? Because our potency, choosing of potency depends upon, choice of potency depends upon the susceptibility of the patient. Choice of potency depends upon the susceptibility of the patient. If the case is pathological and the susceptibility of patient is high, you need to give it high. If the case is pathological and susceptibility is also low, though you need to give the medicine in low, okay, not in high. I hope you are getting it. I hope you are getting it. Now go to page number 201, second para, 201, second para. Attempts have been made to lay down rules governing the dose based upon pathological classification of disease. As for example, the lower preparation should be used in chronic diseases with tendency to disorganization of tissues and in acute diseases. or the higher potency should be used in purely functional and nervous affections. But these classifications are not reliable. They only serve to confuse the mind of the patient, of the student, and distract his attention from the main point, which is to determine the degree of the susceptibility of the particular patient at a given time. Underline this. Which is to determine the degree of susceptibility of the particular patient at a given time. Okay. This is the only guidance for choosing potency. So whether you are dealing with a pathological case, but there is Kent made it popular with his first observation that in every pathological cases you have to give it low, but that is not always the case. You may use high and high. I have seen my teachers using, some of my teachers using high and higher in even the cases of frank cases of cancer. Even the carcinosin was given and there was no but carcinosin was not the first prescription. Okay, after raising the susceptibility, maybe that carcinosin was prescribed, but even first prescription, even it is belladonna given in high potency because the susceptibility of the patient was very high. Okay, how you are going to judge the susceptibility? Because the patient was giving a clear-cut picture of belladonna, throbbing headache, redness of the face, carotid, throbbing of the carotid whenever there is an attack of headache. And that headache was eventually due to a brain tumor. Can you think that in brain tumor, a medicine like belladonna is working? Number one, can you think that? So there is a notion of chronic and acute medicines, and this is an exception. Okay, we have discussed before. Now, can you think that brain tumor, there is a case of brain tumor in the brain, and belladonna was given in 50 potency? Okay, can you think that you have programmed to think that go low with the tumor, but that is not the case. If that symptoms are clear cut and characteristics, okay, that means what? The susceptibility of patient is high. We have given an analogy in some of our previous classes how to judge the susceptibility, that the susceptibility is high. That means the patient, in the room, the vital force is not tied up with the mouth, not tied up hand, not tied up legs, and he is roaming with the unbounded sway and making some noise, making noise with hands, making noise with legs, making noise with his mouth. So the characteristic symptoms are coming up. But in a closed room, vital force have been tied. A man have been tied with his mouth, with his hand, and this. And what kind of symptom it can give? These are the not characteristic symptoms, just the indication that I am suffering and give some help. Here the susceptibility is low. Okay, so only thing which will guide you to choose the potency is the susceptibility of patient. So that is maybe the case when many pathological cases susceptibility goes down, susceptibility of the patient goes down, but that may be case of 60% of cases or 50% cases, but not always. So this paragraph should be underlined. Now come to this the previous treatment of disease. How this previous treatment of disease is affecting the susceptibility. In my experience, this previous treatment of allopathic diseases, treatment of allopathic medicines, this decrease actually the susceptibility of patient. This actually decrease the susceptibility of the patient. That is why in allergic rhinitic cases, we have discussed in last few classes the allergic rhinitic cases of allergic rhinitis suffering for years together. This is what is allergic rhinitis. During the discussion of Robert, we have discussed that this allergic rhinitis is actually the complicated miasmatic disease. Okay, complex miasmatic disease plus years of suffering. First, it is complicated. All the miasms have been complicated, and years of suffering with allopathic treatment. What is the allopathic treatment for this? Anti-allergics and the atropine drops, nasal drops, nasal drops have been given. With these treatment, what has it become? this has become artificial chronic disease, which is masking the original chronic diseases. Okay, so here the susceptibility, you are going to expect a susceptibility of low, and these cases usually you will get the symptoms of nasal blockage, and I use Nux vomica. Now the potency choice of remedy, here my choice of remedy is almost always, okay, there may be some exception that indications are going to other medicines like Aurelia racemosa or what, Amon carb, Amon mure. These are the other medicines which might be selected depending upon the case, but always, almost always Nux vomica. Now the remedy is chosen because of the bad effect of allopathic treatment, plus because of the symptoms of nasal blockage. Now what should be the potency? Years of suffering have been there. My potency will be in these cases, if there is I think there is some raised susceptibility, I used to start with 30, but if there is no other clear cut symptoms are coming out, I used to start with 6. Nux vomica 6 in repeated doses. After giving this, surprisingly, you will be finding that these artificial diseases are gradually subsiding, and there you will get a clear picture of natural chronic disease. Now the actual treatment will start. I clearly told my patient that I clearly used to tell my patient that this is the point where from we are going to treat your natural disease. Okay, all this we have treated. The artificial diseases you have inculcated on yourself with the allopathic treatment, years of allopathic treatment, and there is actually no fault of allopathic physicians, because the patient consulted them once and they have on this medicine for years together. Actually, there is a protocol to use these anti-allergics, 2-3 months continuation, 1 month gap, 3 months continuation, 1 month gap, like this. Or there is a used with different anti-allergies in combination for 2 months in the, especially in the spring season, with the nasal saline. Okay, not steroids, nasal steroid or not, nasal decongestant, but some nasal saline were used. There are some protocol they are following. They are doing good work. They are trying to reach actually they are not they are also trying to cure the patient, but the basic difference from their approach and our approach, this is the concept of disease. That is why in the very initial classes I have told you that build your concept of diseases. Don't see the disease as an allopath sees. Okay, they will finally reach Jotomot Totopoth, but they are taking a long route to reach this rational cure, and I don't know whether they will be able to reach this point or not, but you are already there. You are already there, and starting from there you have your concept, your own concept of disease. Okay, so susceptibility decreases with allopathic treatment. Clear? That was the point we have discussed. Now this I hope you have underlined that chapter, that paragraph. Attempts have been made to lay down the rule. Okay, now that interesting case of digitalis, read 197, page number 197, second paragraph. Such a case occurred in the practice of writer. It was a case of valvular heart disease of many years standing, which had reached the stage of fibrillation. In previous crises, it had responded to potentized medicine. In this instance, however, potentized medicine selected with the greatest care and no effect. An effort was made to arouse the dormant reactivity with the intercurrent remedies. Also in high potency. Underline this. Intercurrent with the intercurrent remedy. Okay, trying to rouse the, when indicated medicine is not working, what we used to do, we think of some intercurrent remedy, is it not? We used to think of some intercurrent remedy. What is intercurrent remedy? That mercurius we have discussed. Sulfur is not working. Gracilis, the physician have devised a method that where sulfur is not working, give mercurius and sulfur will start working. Okay. So this intercurrent, there is a portion of intercurrent also here. I'm searching that but not getting. Leave it. So 197. Also in hypotency, lauretius, carboveg, tuberculinum, medorinum were given as a recommended by homeopathic authorities. In opium, Allen's keynote, open chapter opium. Want of susceptibility to remedies. Second para. Lack of vital reaction to well chosen remedy with no impression. Carboveg, lauretius, valeriana. Okay. So lauretius, carboveg, tuberculinum, medorinum. Why tuberculinum, medorinum? These are the blockages. Okay, tubercular blockage, history of tuberculosis, and your medicine is not working. Think of tuberculinum and bacillinum. History of psychosis, and your medicine is not working. Think of medorinum, thuja. History of syphilis, think of syphilinum, and your indicated medicine is not working. Think of syphilinum, mercurius, like this. Okay. Now opium have been advised by Hahnemann himself in aphorism number 183 footnote, I think. Aphorism number 183 footnote. Okay. That is the different thing actually. To raise the susceptibility of patient, at one more at one more point, Hahnemann have advised using opium. Okay. At one more point, we have discussed it in some previous classes. I think we have discussed in some previous classes. Just I'm not getting that point where we have a dose of. Okay, 183. I think this is 183 where Hahnemann is. Okay, sorry. This is 183 actually. In 183 itself, Hahnemann have told the use of opium as intercurrent, where the symptoms are feels very ill. All these, although his symptoms are very indistinct. Okay, benumb state of nerve, and opium was given. Sorry, this was the aphorism where Hahnemann have advised opium. Now this intercurrent remedy can be used. This opium and opium can be used as intercurrent remedy in intermittent fever. We are using Cinchona. We have told that we can use Cedron also. We can use Chinimum Ars or any other medicine with more intermittency than China itself, and Cedron is one of the medicine in my observation having more intermittency than China. So we can use China. Next, for acute miasms blockage, like history of mumps and your medicine is not working, severe mumps and your medicine is not working, parotidinum, history of severe measles and medicine is not working, morbillinum, history of severe chickenpox and your medicine is not working, malandrinum, history of severe any typhoid fever or any other acute miasms and your medicine is not working. Think of no sort of that medicine. Okay, now carboveg is a general medicine you can think of, history of any acute disease, never well since. Okay, carboveg is an indicated remedy in those cases rather than a intercurrent remedy. Okay, now a side topic we have discussed previously, hair fall after acute fevers or acute diseases, fluoric acid is one of the medicine you can use. Now come back to our aphorisms, our paragraphs. All 197. All efforts failed. The case rapidly progressed toward dissolution, tachycardia, arrhythmia, edema, ascites, endothorax, passive congestion of brain and liver, delirium, suppression of urine, coma, foretold the rapid approach of the end. For a period of over 3 weeks, the symptoms that positively, unmistakably demanded digitalis. I don't know how the symptoms were demanding unmistakably. If there was symptoms of digitalis, if there were clear symptoms of digitalis, digitalis should work in hypotensive, but doses ranging from 40,000 down to drop doses of tincture produces no favorable changes. Okay, maybe the demand of digitalis was in pathological symptom, not characteristic symptoms. Okay, at this point by advice of an eminent allopathic specialist was called into request of the family, full dose of a special preparation of digitalis and salt-free liquid diet were given. Within 36 hours, the patient was passing over 100 ounces of urine in 24 hours. Brain, lungs, and liver rapidly cleared up, and the case, which had appeared absolutely hopeless, progressed steadily to a good recovery. The action of digitalis was clearly curative. No pathogenetic symptoms of any kind appear. For the copious urine for distinctly a curative symptom. Only 6 doses of drug were given at intervals of 2 hours. It was discontinued as soon as its full therapeutic action was established. About 1 month later, it was necessary to repeat the medication in smaller doses a few times for a slight return of the symptoms due to overexertion. This patient was not cured in the sense that his structural damaged heart were restored. For that is an impossibility. Okay, now there is that is not an impossibility. Mitral valvular damage can be cured with your medicine. Okay, mitral valvular damage, especially I have seen some cases of mitral post rheumatic fever, rheumatic heart diseases. Some cases of rheumatic heart diseases are getting well. Okay, that is not impossible now with the medicine mitral valve itself. Okay, it is available in Calcutta with international homeos in LM potencies. Okay, only indication for this mitral valve, using of this mitral valve, is affection of mitral valve. Okay, and it is very working very good in affections of mitral valve. Usually rheumatic heart diseases affect mitral valve. Okay, but I have seen this working in tricuspid valve also, working in aortic valve also. So mitral valve is one of the medicine. You can think of valvular damage of heart. Okay, I have seen at least 3 cases of mitral valve regurgitation in one in a 16-year-old boy and other is in 30-year-old lady. Okay, post-traumatic fever, rheumatic heart diseases, and getting very well. That 16-year-old child has been discharged of my treatment with the use of mitral valve from 0/1 to 0/10. Okay, there was severely dyspnea, cannot walk upstairs, cannot do exertional works, and he is now very fine. The child is very fine, and the echo report of echos came normal 2-3 months before, and I have discharged the patient with mitral valve itself. Okay, mitral valve is a medicine. Now this is specific. We have at some point of time we have discussed the specifics in homeopathy. Even Hahnemann have fixed at somewhere specific, so we can fix specific. The more the narrower the symptoms are, the more narrower the medicines. Mitral valve regurgitation, only single pathology. Mitral valve pathology is there, and from this pathology what all symptoms are expected and that are fixed, and you are fixing your medicine. There is nothing wrong in it. The moment the patient is traveling back to the normal, see, this is the journey of disease to this pathology. Okay, and this pathology is fixed, is not going to change, and due to this pathology symptoms are coming up. So these symptoms are same. If the symptoms are same, medicines is same, but here at this point of time or at this point of time, okay, symptoms are variedly different, so medicines are variedly different. But once the pathology is fixed and once you are getting up the secondary symptoms due to this pathology, okay, I'm discussing very vital point. Secondary symptoms due to this pathology is not going to change because the pathology has been fixed there. Same exertional dyspnea will be there, same murmurs will be there, same heart failure will be there, all will be progressed in same direction because the pathology has been fixed. Pathology is not dynamic anymore. So the secondary symptoms you are getting, what are these? These secondary symptoms are actually coming from a fixed pathology. Okay, If the pathology is fixed, the symptom is fixed, medicine is fixed. So I fixed the medicine for mitral valve, mitral valve pathology. Medicine has been fixed. Mitral valve, use it in 7 out of 10 cases. You will get your result. Okay. Those 3 cases may need some assistance with other remedies. Okay. Clear? So this is not for your viva table, but for your exam, for your clinic purpose, not for your exam purpose. Clear? So this pathology of valvular pathology is not incurable anymore. Take with confidence. These cases take with confidence and use mitral valve. Procure mitral valve from Kolkata International Homeos. They are making it. Mitral valve. Maybe they are making tricuspid valve or aortic valve also, but I am having no experience with those. I am using mitral valve in my clinic for every case of this mitral valve pathology. Okay. Now, this patient was not cured in the sense that is a structurally damaged valvular heart valves were restored. For that, it is impossibility, but the action of indicated drug was curative in its nature as far as it was possible to go. His life was saved and prolonged, and he was restored to measure to comfort and usefulness when otherwise he would have died. Digitized in material doses was homeopathic to his condition symptomatically and pathologically, and no other drug could take its place. That stage of disease, no other medicine of any kind was given. In contrast to this case, and in further illustration of the necessity for being prepared to use the entire scale of potencies, the following case from the practice of the writer is presented. Okay, this case you should read by yourself and ask. This is very this is also interesting case. Read by yourself and ask me if you have any doubt. Now susceptibility is modified by habit and environment. These are the things you have to read by yourself, judging the susceptibility. Now the next point of posology is the repetition. Okay. Now repetition, we will read it. We will read it. It remains to speak of one more important connected with the general subject of homeopathic posology, the repetition of dose. The management of the potency is in regard to the management of the remedy in regard to potency and doses is almost as important as the selection of remedy itself. The selection of the remedy can hardly be said to be finished until a potency and doses have been decided upon. These 3 factors: selection of remedy, okay, minimum, that is doses, 3 factors, and when I have discussed there 3 factors involved in the operation of prescribing. No one of them in the matter of indifference, and not one of them can be disregarded. The first question which confront us in whether to give one dose or repeated dose. The second question is, if we give one dose, when shall we repeat it? Third, if we give a repeated dose, how often shall we repeat the dose and when shall we stop dosing? Many expert prescribers begin the treatment of practically, remember, expert prescribers, underline, we are not expert prescriber. Consider yourself not expert prescriber. Okay. Expert prescriber begin the treatment of practically all the cases by giving a single dose of the indicated remedy and awaiting the reaction. Okay. Give a single dose and wait as long as it is working. This is 4th edition. This is 4th edition. And somewhat in the 5th edition, for striking amelioration, if the striking amelioration is there, give a single dose. Okay. Now I will narrate a few cases from my clinic where I used to give sulfur 31 single dose and wait for 3-4 months together. But that doesn't happen in the very initial time of that case. Okay, after some treatment with other medicines in repeated doses, the patient have been stable and is staying with me. Then is the point when I'm going to select a single medicine and select a single dose and wait for long. Okay. So that is that will also happen in your clinic after you have treated your patient for long. Okay, after treatment for long, there are some some complexities have been opened up. Okay, so you can decide on your medicine and single dose, but that is not always the case. Indicated remedy and awaiting reaction. This is an almost ideal method. Underline this. The ideal methods almost always not exist. Ideal gas. Does ideal gas exist? No. Ideal thing. That is the ideal. What is an ideal? Ideal is to look upon. There is an ideal you will look upon, but you are not reaching there. But that is your guiding principle. That should be ideal. Okay. Ideal condition is always not existent. Okay. There is an hypothetical ideal condition. This is an almost ideal method for expert prescriber. Underline this. Of course, we all expect to become expert prescriber and will therefore accept that as our ideal. Okay. Hahnemann's usual teaching, the outcome of his long and rich experience was to give single dose and avert his full action. And Stotclose is talking about, maybe this article. I have in the beginning, I may have told you that Stotclose is a collection of articles. Okay, Stotclose has not been written as a book. It is a collection of articles of different lectures delivered at different times. Okay, maybe this Posology lecture was delivered when the 6th edition was not published, or author was not that much interested in 5th edition. Plus, this Stotclose is heavily copied from von Grovel's homeopathic philosophy, and you will see that B.K. Sarkar's B.K. Sarkar's lectures on organon of medicine is also heavily copied from this Stotclose. Stotclose is copied from von Grovel, and B.K. Sarkar was copied from Stotclose, heavily copied from, with all due respect with Dr. B.K. Sarkar. Few of his some of his lectures in this his collection of lectures on homeopathic have been heavily copied from Stotclose. Similarly, with all due respect to Stotclose, this book was heavily copied from von Grovel's homeopathic philosophy. Okay. Now, this we will see that chapter number 12 is talking about the development of Hahnemann's philosophy in the 6th edition of the Organon. So this is a separate article, maybe published at some point of time, maybe given as a lecture in some point of time. But here Stotclose is talking about 4th edition. Maybe von Grovel was talking. Maybe von Grovel is talking about 4th edition, or Stotclose is talking about 4th edition. This is the ideal condition. Wait its full action. The wisdom of this teaching has been amply confirmed since day by many of his followers. The duration of action of the remedy which acts varies, of course, with the nature and rate of progress of disease. In a disease of such violence and rapid tendency towards death or cholera, as cholera, for example, the action of indicated remedy might be exhausted in 5 or 10 minutes, and another dose is required at the end of the time. In a slowly progressing chronic disease like tuberculosis, the action of doses of curative remedy might continue for 2 or 3 months. Okay, so progress of disease, the nature of disease was there, we have discussed. So if the disease is progressing rapidly, you need to the action of the medicine is exhausting rapidly. Here you need to repeat it at shorter interval. But if disease is slowly progressing, your medicine will be acting slowly. The only rule which can be laid down with a safety is to repeat the dose when only the improvement ceases. Underline this. Underline this. Okay. So this is from the 5th edition. Stotclose is quoting from the 5th edition. Read it by yourself. Now the repetition. Last this section of repetition, page number 204. 204. The single dose of indicated remedy repeated whenever improvement ceases, as long as a new or changed symptom do not indicate a change of the remedy, is adapted to all cases, but especially in chronic cases and to such acute cases as can be seen frequently and watched closely. The nature and progress of disease will determine under this rule how often the dose is to be repeated. Cases may present themselves, however, which cannot be watched as closely as we would like. We may not be able to visit the patient frequently, nor remain with him long enough to observe the full period of remedial action. In such cases, it is permissible and indeed necessary to order a repetition of dose at stated interval of 1, 2 or 3 hours until improvement is felt or seen, or perhaps until our next visit. In such cases, it is well directed that the medicine be stopped as soon as the patient is better, giving some simple instruction to the nurse to wait to what constitute a reliable signs of improvement according to nature of case. If a patient is so gravely ill as the required doses at interval of less than 1 hour, the physician's duty remain with the patient and judge of his condition, progress of himself, progress for himself unless he is absolutely sure of the remedy or is telephonic communication with the case or is in telephonic communication within the case. So this is where we can, according to our own experience, can judge. If you read the pointers for the constitutional remedy by ML Tyler, you will see that ML Tyler have almost always have fixed the repetition to in acute diseases to every 4 hours. If the patient start feeling better, the repetition interval is increased, and that is the method I'm using in my clinic. I used to give in acute cases a solution of medicine, 100 ml solution of medicine repeated every 4 hours for acute cases, and I'm getting results with that. With acute cases of malaria, whether it is typhoid and acute viral fevers, have been well tackled with this repetition. In these acute cases, you need to repeat your medicine more often than necessary. In some than you think necessary. In some cases, I used to repeat the medicine even in 15 minutes duration or 5 minutes duration in severe cases. The indicated medicine repeat, and in some cases I use the olfaction to repeat at more shorter interval. Okay, olfactions are safe. A repetition won't do harm to your patient. Okay, in olfaction, LM potencies. So this ends our chapter of repetition. I have asked you to read 2 things from Hughes pharmacodynamics appendix and this Dudgeon's appendix, and that 246 footnote. Read that. If you have any question, you can ask me in group, or you can ask me personally. Thank you for your attention.